So I wanted to respond to this in detail in a video because I think there's actually a number of related conversations happening in parallel. First, just right off the bat, I agree with you that if the question is about receiving support and finite resources, and we say who is most deserving of those resources, as a society, I think we all agree the one who was victimized is the one sort of has first dibs on treatment, help, support, right? But now we have a second question about what do we do about the abuser and what is happening there, and is there treatment, is there support that can happen? And I think part of that depends on making that distinction that I talked about in that last video between psychopathy proper, that sort of hair psychopathy, the PCL checklist, where there's that lack of remorse, inability to empathize or feel guilt. That seems to be its own distinct construct from personality disorders, right? And that's what I was talking about in that video. So when I talked about the treatment and feeling better, I was referring to that second category of personality disorders where there is often an overlap with symptoms and sometimes even diagnostics for psychopathy, but a distinction. So in personality issues, that's where that black and white thinking comes from. And that's where we can provide actual treatment and growth. So when I describe, for example, those individuals feeling better, I'm not saying like a solve where they put something on their skin and the pain is decreased, but a true feeling more, and perhaps I should have used that phrase, to feel more, to feel that shades of gray space, which is where often more empathy, remorse, and accountability can come from in the category of those classic personality disorder diagnoses, like, borderline, antisocial, schizotypal, right? We had histrionic, right? We have a whole list of classic personality disorder diagnoses. And the argument is those are all different expressions of black and white thinking. So I hope that helps clarify, and also what I was getting at in terms of a social approach to growth for all, which does not negate the damage of the abuse or the potential responsibility for making amends for that abuse, but rather that in certain cases there is room for growth. Appreciate the comment, thank you, and appreciate the conversation from everybody on all of this and the other threads and videos.